Hi, guys. I'm Kenya Brown, and welcome to Black Health 365. Now, today we are talking about breast cancer in Black Americans. And cancer screenings are important because cancer screenings help find cancer early when it's easier to treat. According to the American Cancer Society, when breast cancer is caught early, the survival rate is nearly 99%. This is why annual screening mammograms are important to catch breast cancer at its earliest stages. But statistics show breast cancer survival rates in African American women and particularly older African American women are lower than they should be. Joining us today to talk about this is Dr. Ashley Simpson, a breast cancer surgical oncologist at University Hospital Simon Cancer Center. How are you, Dr. Simpson?
I'm doing well, Kenya. Thanks for having me.
Absolutely. So let's first talk about what the screening guidelines are for breast cancer because it seems like it's changing. And when should a woman get her first mammogram?
That's a great question. So, a woman should get her first, we call it a baseline mammogram, beginning at age 40, and we recommend going yearly after that. Some women may even need to go earlier if they have a family history or any other risk factors, and they may even need to be screened more frequently.
Wow. Okay. So while we have screening mammograms available, the data is showing African Americans have lower survival rates for breast cancer. Can you talk to why that is?
Right. There are a whole host of factors that can create this disparity. One thing that we consider is what we call tumor biology, meaning how does the tumor behave? African American women do have a higher incidence of the most aggressive form of breast cancer, we refer to as triple negative breast cancer. So, triple negative breast cancer can be more difficult to treat, it can be more likely to recur, and oftentimes it requires the use of chemotherapy.
Wow. So, and just a question, what should women be looking for? I know 40 is where we're going to be starting those screenings. If there are no other factors, should we be looking for those other factors earlier, or should we be looking for different signs?
So it's really important to know your family history, and this is both on your mother's side and your father's side. One of the big indicators we look at for risk is your family history. And so, on either side of the family, if you have someone that's had breast cancer, and this can be a distant relative, a great grandmother, a great aunt, a second cousin, if anyone's had breast cancer, we want to know what age they were when they were diagnosed. And we want you to start screening 10 years before that. So 10
Wow.
years or 40, whichever comes sooner. So if you had somebody in their mid 40s, you should start screening in your 30s.
Mm.
Other things we look at are, potential risk factors. So if people had any sort of chest radiation for a prior medical condition, that's a risk factor where we should be looking at screening earlier. Sometimes family histories might help us also detect a gene mutation in the family. And so, those individuals, if they are gene carriers, we know they have a significantly elevated risk for breast cancer. Sometimes we even recommend screening as early as 25 in those patients.
Wow. Okay. That is very helpful information. Now, when we look at breast cancer, it also appears there's a difference in age of African Americans being able to beat breast cancer. Can you talk about that and how age impacts treatment?
Right. So when we talk about treating breast cancer, sometimes that may mean chemotherapy. Chemotherapy can be very difficult on your system. And so it depends on your overall health and any comorbid conditions you may have. And so if older women are also battling things like heart disease or renal issues or diabetes, that can make it difficult to offer standard of care treatment. And if they're unable to undergo chemotherapy in that standard of care, that can lead to decreased survival rates.
Wow, it all makes so much sense as you say it, and that's very great information. Now, is there anything else that we need to know to help with improving outcomes when it comes to breast cancer?
The biggest thing that we really want to encourage every woman is to stay up to date on your screening mammogram. There may be a myth that if it doesn't run in your family, you're not at risk, but that's quite frankly not true. We know
Yeah.
that 1 in 8 women in their lifetimes will be affected by breast cancer. And so it's really important for every single one of us to get our mammograms every single year. We also want to make sure that we're keeping up to date with our own breast health. So, doing our exams and noticing if there's any changes month to month when we do those self breast checks.
And how big of a change should we be looking for? Like if you feel the slightest lumps or changes, should we be calling immediately?
So, what I would say is it's most important to do your breast exam monthly. You don't have to do it every single day, but it's important to kind of learn your breast anatomy. Some people might notice that they have, lumpy breasts and they might feel it's kind of difficult to do an exam. But if you notice a change from your normal, then it's important to get in with a provider and get some imaging so that we can take a closer look and see exactly what's going on.
Absolutely. Make sure you share this video. It's very important for you to get these screenings so that you can have a better outcome if this is something that you end up experiencing. But we thank Dr. Ashley Simpson for being with us here today and sharing this important information with our audience. To schedule a mammogram, call 216-759-8282 to learn more about our Black Health 365 program. Visit wzakcleveland.com for slash BH365 for more information. Thank you so much, Dr. Simpson.
Thank you. Have a great day.
Thank you, and we'll be back.